So, our presentation today is Oral Health as We Age. This is a quote by C. Everett Koop. It's "You're not healthy without good oral health." Oral health is the health of the mouth and the surrounding facial structures that allow you to eat, breathe, and speak. So, it means having healthy teeth, gums, lips, tongue, mouth and throat lining, salivary glands, chewing muscles, hard and soft palate, and upper and lower jaw. And the oral cavity refers to the mouth. It also includes the lips, the inner lining of the cheeks and lips, the front two-thirds of the tongue, upper and lower gums, the floor of the mouth under the tongue, bony and muscular portions of the roof of the mouth, small area behind the wisdom teeth, and this is where food and air enter your body. And it's very important to keep the oral cavity healthy.
I want to discuss the importance of oral health and our overall well-being. A healthy oral cavity is crucial for a variety of reasons. First and foremost, it allows us to communicate effectively. Being able to speak clearly and confidently is an essential aspect in both personal and professional interactions, as we know. Moreover, good oral health enables us to taste, chew, swallow nutritious foods, which are also crucial for maintaining our overall health and energy levels. Our oral health also plays a role in ability to express emotions, particularly through smiling. A confident smile can boost self-esteem and enhance social connections. Positively affects our mental health, and ultimately maintaining a good oral health is not just about keeping our teeth clean, it significantly contributes to our quality of life and overall health. Let's explore the strong connection between oral health and overall health. Research has shown that poor oral health can lead to serious systemic health issues. For instance, there is clear link between gum disease and diabetes. Poor oral health can worsen diabetes by increasing blood sugar levels, creating a cycle of health problems. Similarly, studies have indicated that gum disease is associated with an increased risk of heart disease. The inflammation present in mouth can contribute to systemic inflammation, which may affect the heart. Additionally, poor oral health can be a risk factor for osteoporosis, especially in elderly patients, where the loss of bone density can lead to tooth loss. We must also consider pneumonia, where bacteria from the mouth can be inhaled through the lungs, leading to respiratory infections, particularly in vulnerable populations. So these examples highlight the crucial importance of maintaining a good oral health, which is not only for dental health, but also for preventing a range of other health conditions. Now let's delve deeper into the relationship between diabetes and oral health. This interaction operates like a two-way street. On one side, inflammation in the gums can lead to elevated blood sugar levels, which exacerbate gum disease. This creates a vicious cycle where poor oral health can worsen diabetes. Conversely, having diabetes can significantly impact oral health. Individuals with diabetes often experience changes in the saliva composition, leading to dry mouth, which can increase the risk of infections, which can further complicate oral hygiene. This connection underscores the importance of managing diabetes effectively through diet, medications, and regular checkups. Regular dental visits can also become crucial for early detection and management of oral health issues, making it essential for an individual with diabetes to prioritize oral hygiene. So this two-way relationship emphasizes the oral health is integral to managing chronic conditions like diabetes. Moving on to the next systemic condition, pneumonia. It's important for us to understand why this condition matters. Pneumonia is a common hospital-acquired infection that can have serious complications for patients. It can lead to longer hospital stays, increased healthcare costs, and most importantly, can become very dangerous for especially elderly and seniors with weakened immune systems. The good news is that maintaining good oral hygiene can significantly reduce the risk of pneumonia. Simple preventive measures such as regular brushing and flossing help eliminate the harmful bacteria from the mouth, which can otherwise be aspirated through your lungs. This is particularly crucial for seniors who are at higher risk for both oral health issues and pneumonia. Therefore, by adopting a good oral care habit, we can improve our oral health while potentially preventing severe health complications like pneumonia, contributing to a higher quality of life. And this reinforces the idea that oral health is crucial for our overall health strategy.
So now let's talk about how nutrition plays an important role in both oral health and overall health. For example, eating a balanced diet that's rich in fruits, vegetables, lean proteins, and whole grains really helps maintain strong teeth and gums. It's also important to remember that digestion starts in the mouth. Your teeth break down food, and saliva contains enzymes that begin to digest complex carbohydrates. The tongue pushes food to the back of the mouth for safe swallowing. So proper nutrition is key for maintaining both oral health and overall well-being, especially as we age. As we age, there are several foods that we should focus on increasing in our diets to support oral health. Dairy products like milk, cheese, and yogurt are rich in calcium and phosphorus, which help strengthen both tooth enamel and bones. Leafy greens provide essential vitamins for gum control, while crunchy fruits and vegetables like apples and carrots can help clean teeth and stimulate gums. Additionally, fatty fish like salmon are high in omega-3 fatty acids, which reduce inflammation in the gums. Finally, staying hydrated with water is crucial to wash away food particles and bacteria, reducing the risk of tooth decay. So, as much as there are foods that support good oral health, there are also foods that can be harmful and should be limited, especially as we age. Sugary foods and drinks like candy and soda are major contributors to cavities because they feed harmful bacteria in the mouth. Starchy foods such as bread and chips break down into sugar that also contribute to plaque buildup. Acidic foods and drinks like citrus fruits and vinegar-based dressings can erode tooth enamel over time. Alcohol can dry the mouth out and reduce saliva production, increase the risk of tooth decay and gum disease. And lastly, sticky foods like dried fruits and caramel tend to cling to teeth, making it harder to remove sugar and increasing the likelihood of cavities. By being mindful of these foods, we can protect our oral health. So there are several common oral health issues that tend to arise as we age, such as cavities, gum diseases, oral cancer, dry mouth, and denture-related problems. Each of these conditions can significantly impact the quality of life.
So the first common oral health problem is cavities. How do you get cavities? When you eat foods containing sugars and starches, bacteria in your mouth metabolize them and produce acids that break down your enamel. Over time, the bacteria form a sticky film called plaque, which allows them to thrive and continue eroding your teeth, ultimately causing cavities. The second common oral health problem is gum disease, also known as periodontal disease. This is an infection that destroys the soft tissue and bone that support your teeth. There are 5 signs and symptoms of gum disease. 1. Swollen, red, and dark purple gums. 2. Tender to touch and puffy gums. 3. Pink color on your toothbrush after brushing, which means blood. 4. Bad breath that won't go away. 5. Sensitivity to hot and cold. The third common oral health problem is oral cancer. There are some warning signs. Change in color in your mouth, which can be white and red. Difficulty chewing, swallowing, and moving jaw and or tongue. A sore or irritation that does not go away. So about 75% of oral cancers are attributed to heavy alcohol and or tobacco use. There are more signs. Shift in your position of teeth, rough bumps in your mouth, areas in your mouth that are painful or tender to touch, and numbness.
Dry mouth, which is also known as xerostomia, is a symptom described as persistent feeling that there is not enough saliva in your mouth. It can be caused by a few sources, such as chemotherapy, radiation to the head and neck, health conditions, and medications. It is not a normal part of aging, and it can lead to a variety of issues, such as loss of tooth, difficulties in tasting, chewing, swallowing, and speaking, sore and uncomfortable tissues in the mouth, and you're more prone to oral infections. Cigarette and drugs. Here are some effects that they can have on your mouth. For drugs, it can lead to dry mouth, ulcers in the mouth, cracked teeth or loss of teeth, erosion of the gum and bad breath, and a lower quality of life. Cigarettes, in addition to many of the bad effects that can lead to your overall health, they can cause bad staining and gum disease, dry mouth, and very bad breath, and your teeth will start to show its roots. Oral hygiene. So what you want to do is brush your teeth and tongue twice a day because it is the most effective way to disrupt plaque formation and combat the bacteria that causes caries. Be sure to brush all surfaces of each and every tooth. Spend at least 2 to 3 minutes in total, and make sure to angle the toothbrush towards the gum line and brush gently away.
When you are brushing your teeth, you want to make sure that you're using a soft bristled toothbrush. In the description, you'll likely be able to see on the packaging. You replace it every 2 to 3 months when it's all worn down and the bristles are frayed. You can also use an electronic toothbrush because it often keeps track of the time and turns off after 2 or 3 minutes. In addition to brushing your teeth, also want to make sure that you floss to get any material from in between your teeth out. So you'll start with a piece of floss that's about the length of your forearm. And after wrapping it around your fingers a few times, you will gently slide the floss between your teeth and curve it into a C shape around each tooth. And you want to move it up and down to remove any of the plaque. At the beginning, when you start flossing, you might have some discomfort and bleeding, but that's totally normal, so not to worry. And as you continue to floss and that becomes more incorporated into your daily routine, that discomfort should subside. Fluoride varnish is also a non-invasive way of really protecting your teeth, and you can ask your dentist or dental provider for this procedure next time you visit. And it's pretty much just a protective layer that coats the outside of your teeth and encourages them to just get stronger.
A popular option of care that people have are dentures, and dentures overall aid your health by improving chewing for better digestion and nutrition. And dentures are overall going to help you with speaking better and preventing future dental problems by replacing the missing teeth. If you have dentures, it's extremely important to take them out at night, and it's also important that when you're taking them out at night that you're also taking care of them so that they're going to be great in the morning for you to use throughout the day. So some denture care that you can be doing to prolong the life of your denture is to brush with a soft brushless toothbrush and put mild soap on it. Or if you get a denture cleaner at CVS or your local drugstore, you can put it in there as well. Rinse it under cool water and soak it overnight in water or denture solution. Please make sure to not use hot water, bleach, or abrasive cleaners, as that can hinder the lifespan of your denture and can cause it to break and crack, and you might need to go to your dentist to get another one. So here are some risk factors that can negatively affect your oral health. So when you're stressed, you might grind your teeth during your sleep. When you're grinding your teeth during your sleep, that's going to create not only the stress that you have, but also stress on your teeth as well. That can lead to jaw pain, neck pain, headaches, ear aches, sleep disruption where you're waking up at night due to the pain. Also, because of the hard forces that you're putting on your teeth, it can lead to them being more sensitive. It can also wear down the teeth as well, making them flatter. There's also another term called bruxism, and that's going to be when you grind and clench your teeth. A lot of times really holding your mouth down together. And so it can be something that's really unconsciously done. If you're feeling a lot of stress in your head area, maybe it's that you're just grinding and clenching your teeth so much, and to just release that, put your tongue on top of the roof of your mouth and just take the two arches of your teeth away from each other, and that can help decrease the stress that you feel in your head. If you feel that it's something that's consistently a problem, you can go to your dentist and ask to see if you can get a night guard, because the night guard can help you at night to prevent from unconsciously clenching your teeth and causing future damage. So overall, our take-home message. So for brushing, there's a bunch of different toothbrushes that you get at a drugstore, right? And there's going to be different types of bristles. Only ever use a soft bristle toothbrush. Something that's harder you don't want to use. It's going to be way too abrasive for your teeth. Brush all your teeth and also your tongue for 2 to 3 minutes each time, twice a day, and floss in between your teeth every day as well. For your diet, if you decide to eat snacks and soft drinks, candy, or any sugary food, make sure to drink water after and don't let food stay in your mouth for too long. Let's say you have something acidic or super sugary, that's going to be eating away at your teeth, so drinking water can help reduce the acidity in your mouth during that time. Proper nutrition provides essential nutrients like calcium, phosphorus, vitamin D and C, which are crucial for maintaining strong teeth and healthy gums. And just make sure that you don't have food debris left behind, because the bacteria will take over. So that's why it's super important to frequently brush and floss your teeth. In general, you want to stay beautiful inside and out. So just avoid stress, cigarette, drugs, and just anything else that can further harm your teeth. Listen to your dentist advice that you go to, and they'll help keep your teeth and gums healthy.
One of the things that you spoke about in terms of nutrition was dairy products, like getting enough calcium and things like that. For someone who has a milk allergy, is lactose intolerant, are there alternatives there? I'm vegan. Is there a way to get that without necessarily it being dairy?
If you're allergic to dairy, you can still do leafy greens, and then also the plant-based milks like almond, soy, oat milk. They're also a pretty good source of calcium. So in combination with the other things, you can support your oral health the same way.
When you're using the electric toothbrush, it's going to be on and it's going to be moving as well. As long as you're kind of just keeping it on the tooth and letting it do its thing, and then you move on to the next tooth, that's the best thing to keep in mind. Make sure that you're not aggressively brushing at the same time the toothbrush is going as well, because then once again, that can cause extra abrasion on the tooth, which can kind of whittle it down in the future.
Fluoride toothpaste versus the natural non-fluoride toothpaste. What's your take on that?
For that, I would say definitely fluoride. I know there is some common misconceptions, common beliefs about the systemic effects of fluoride that could be quite harmful for the body, but that is not true. The amount of fluoride found in toothpaste and in also drinking water, tap water, is so minuscule that it could not have that severe effect on the body, especially for adult patients. It could be potentially harmful for children and developing people, but for adults, it's not at all a concern. And for that matter, fluoride toothpaste is always advised because the enamel of a tooth is one of those tissues in the body that does not reproduce, that cannot heal itself after it's been chipped off or it's been destroyed by caries. So the only way to protect it and to somewhat heal it is by using fluoride, and that can kind of stop the progression of the caries and sometimes reverse that process since there is no internal healing of the enamel. So with that in mind, fluoride toothpaste is definitely the go-to option.
How much toothpaste are you supposed to use? People say like a pea-sized amount, and then in commercials it's that swirl. Like, how much should you actually be using?
A pea size amount, so like literally just the size of a pea. I think like the commercials just do that more for the marketing effect of it looking nice and stuff on the
Yeah.
toothbrush, because they do like the whole length of the toothbrush, but just so long as you have a pea sized amount, that's all.
For people with dry mouth, is regular mouthwash effective? Is there a different kind of mouthwash or other treatments to help with dry mouth?
Any kind of alcohol-free mouthwash which has less severe taste, and they could be as effective and could be normally used. The good thing about alcohol-free mouthwashes is that the taste is much more tolerable. The ones that contain alcohol can have some really strong
Really
taste.
strong.
And for some patients, if they have dry mouth or if they have oral lesions, blisters, ulcers, that could be really painful. So alcohol-free mouthwash is definitely advised. In terms of efficiency, they're exactly the same. Alcohol-free mouthwashes could be a great alternative.
There is one brand, Biotene, that one kind of tailors more towards dry mouth, but it's also alcohol free too and stuff. So even if you can't find that brand, as long as you're going with an alcohol free based mouthwash, that's really the best that you're going to get for dry mouth.